March is also Colon Cancer Awareness Month.
And today in Your Health with Bellin, we're talking about prevention and screening, and we're going to debunk some myths that surround the disease. Dr. David Stample is here. Good morning to you.
Good morning.
Good morning.
Well, why is it so important for us to be talking about colon cancer and raising that awareness?
Because colon cancer is the number 3 cancer in the country. 1 in 20 people will get colon cancer in their lifetime, and it's the number 2 killer after lung cancer. That makes it very, very important. It's also very preventable, which is why we need to talk about it.
Well, let's talk about screening. That is one way to prevent it. Who needs to be screened?
Everyone needs to be screened starting at age 50.
Okay.
Age is the biggest risk factor. Some people need to be screened sooner, such as people with a history of type 2 diabetes, history of inflammatory bowel disease, and African Americans.
And if you have also an immediate family member with the disease,
absolutely.
who would qualify as that?
That would be first-degree relatives like parents, children, siblings.
Okay.
What are the different tests that are available for screenings? Because there's one that certainly gets more talk than others.
Well, the most effective and the gold standard is colonoscopy, done every 10 years for screening. Colonoscopy does 3 good things. One is it prevents cancer by finding polyps when they're small and curable. It can also treat cancer by removing small cancers in their early stages, so it's very effective in preventing cancer.
What are some of the other ways?
There's other tests like barium enema, which really isn't done too widely anymore because it's less accurate, and there's also a CT colography, but you still have to take a preparation, and if they find anything, then you need a colonoscopy anyway. So.
Oh, okay. Now, I see commercials all the time for the at-home tests. Are those recommended?
Well, they can be helpful in certain situations. The problem, if it's positive, you still need a colonoscopy, and the company who makes one of the most popular ones says if it's negative, you still should have routine screening done, so it doesn't help you a whole lot.
So you're having a colonoscopy anyway.
Colonoscopy.
Exactly.
Well, we mentioned some myths and misconceptions people have regarding colorectal cancer. So let's take a look at some of those, and you're going to kind of help bust those. Some people think it's an automatic death sentence, so why even bother screening?
Because there's a 90% survival when you catch colon cancer early. It's only in the late stages of advanced colon cancer where the survival is 13% at 5 years, so there's a huge advantage in catching it early.
Wow. Sure. Myth number 2 is there's nothing I can do to prevent colorectal cancer?
Colonoscopy is enormously helpful in preventing colon cancer by removing polyps when they're small. Cancer always starts as small colon polyps, and if you remove them, you greatly reduce the chance of developing colon cancer in the future.
And it's easy to make the excuse, well, I hear that getting a colonoscopy might hurt. Not the case.
That's correct. People get good sedation for these procedures. People don't remember it. They wake up and say, well, when is this going to start? And we're all done. So it really goes well for people.
Exactly. All right, well, this is a great month to learn more about colonoscopy and colon cancer and get yours scheduled. You can do that by calling Bellin at 920-431-5450 or heading to bellin.org.
Thanks, doctor, for being here.
Thanks, Doc.